I'm going to be presenting Technical Subject Area Task A, which is aeromedical factors. The first thing is how to obtain a medical certificate. To obtain a medical certificate, you have to schedule an appointment with an aviation medical examiner, also known as an AME, to apply for your medical certificate. You can visit this website at MedExpress, which is an FAA website, and complete their form 8500-8. When you arrive, you have to show proof of age and identity by presenting a government-issued photo identification. This, in most cases, can be a driver's license. It will have both your photo ID and proof of age. You could also bring any sort of government photo ID, which is a school ID with your picture and a birth certificate to prove your age. So it doesn't just have to be a driver's license. It could be other things. Any AME can grant a second or third class medical, but you have to go to a specific AME that is designated to only grant first class medicals. And the picture on the right is just a sample of what a medical would look like. This is a list of medical deficiencies. So the following conditions are listed in the regulations as disqualifying medical conditions. However, in many cases, when a condition is not adequately controlled, the FAA will issue medical certification contingent on periodic reports. So this is just a short list of bipolar disease, epilepsy, heart replacement, psychosis, substance abuse, anything that is disqualifying in the FAA's eyes. There are medical deficiencies where you can still obtain a medical or some other thing like a statement of demonstrated ability, also known as SOTA. So a SOTA would be granted to a person whose disqualifying condition that we just saw is non-progressive and found capable of performing the airman duties. This does not expire, but it can be withdrawn. So not only is it things on this list, but it could be losing a hand and being able to demonstrate that you're still capable of safely flying an aircraft, and it's not a disqualifying condition as long as you're able to demonstrate it. Basic med, this is something that allows pilots to fly without a medical certificate as long as they can meet certain requirements. So these requirements in pilots would include having a U.S. Driver's license, has previously held a medical certificate, complete a physical exam by a state licensed physician every 48 calendar months, and also complete a basic med education course within the past 24 calendar months. Some other limitations to basic med would be your aircraft and operating requirements. This would be any aircraft authorized to carry no more than 6 occupants, which would be 5 passengers. If you were the pilot, only 5 passengers would be able to fly with you, or 6 occupants in total. It'll have a maximum certified takeoff weight of 6,000 pounds, may not operate above 18,000 feet, may not exceed 250 knots, may not fly outside the U.S., and flights may not be operated for compensation or hire. Moving on, we'll talk about hypoxia. Hypoxia is the lack of sufficient oxygen in the blood, tissues, and or cells to maintain normal psychological function. So there's 4 types of hypoxia, which is hypoxic, hypemic, stagnant, and histotoxic. And we'll go into those in just a second. Here are some symptoms of just general hypoxia. It will include things: euphoria, headache, drowsiness, dizziness, tingling, numbness, foggy decision-making, confusion. In this chart over here to the right is the time of useful consciousness. So this is the ability of the pilot to remain conscious when they're exposed to these high pressure altitudes. And as you can see, as you increase in altitude, your time of useful consciousness is going to decrease significantly. At 20,000 feet, you're going to have at least 30 minutes or more of useful consciousness where the pilot is able to think clearly, have time to get to a lower altitude, but as you go up, you can see that 40,000 feet, 45,000 feet, it's down to 15, 20 seconds, or 9 to 15 seconds. There's not much time there, and it just shows you the drastic effect that altitude can have. So hypoxic hypoxia is a little bit of what we were talking about with time of useful consciousness. So this is the lack of oxygen absorbed in the body due to atmospheric conditions. So that decrease of pressure as the altitude increases will lead to the body not being able to actually absorb the oxygen. There's just not enough pressure that there would be at sea level. In order to correct this, the best thing to do is, of course, descend to a lower altitude as soon as you can. Also, to inform your instructor or your crew that you're with, make sure to slow your breathing rate by counting to 4 or 5 seconds between breaths. And then if you have oxygen equipment, check those connections. Any equipment, if it's applicable. Of course, we don't have this in our Piper Archers, but it's something to keep in mind for when you move on to bigger aircraft. There's also hypemic hypoxia. So this occurs when the blood is not able to carry a sufficient amount of oxygen to the body's cells. So you can think of this as carbon monoxide poisoning, or blood loss if you had just donated blood. And the best way to prevent hypemic hypoxia is learning about it. Learning that I've just donated blood, now I'm going to go up to fly. Wait a minute, that's probably not the best idea, because now my blood's not going to be able to carry enough oxygen that you need. And of course, if you are flying and you realize this, inform your instructor or crew that you're experiencing these symptoms. Next is stagnant hypoxia. This is oxygen deficiency in the body due to poor circulation of the blood. I think of heart conditions, but it's also due to pulling excessive G's, cold temperatures because they'll reduce and constrict blood vessels. So this is just physically your body cannot carry that circulation of oxygen in your blood. So beware of conditions that could bring on stagnant hypoxia is your best chance of recognizing symptoms. So you would know if you pull G's, if you're doing aerobatic flights, that this is a possibility. If you're cold, it's a possibility. And if you have any heart conditions, this is a possibility. And of course, always inform your instructor or anyone that you're with. Then there's histotoxic hypoxia. So this is the inability of the body to actually use the oxygen. So this can be caused by alcohol and other drugs, such as narcotics and poisons. You should consult aviation medical examiner and AME if you have any questions related to specific types of medication. You can also visit the FAA website that there is a link to here to find out what over-the-counter medication is safe to fly with. And then you should always comply with the FAA regulation Title 14 CFR 91.17 concerning alcohol or drugs consumption. So this would be no person may act or attempt to act as crew member of a civil aircraft within 8 hours of consumption, while under the influence, while using any drug that will affect the person's safety or judgment, and while having an alcohol concentration of 0.04 or greater in the blood. And then we can go in later about how that affects the safety of flight. But this is one cause of histotoxic hypoxia. Moving on from hypoxia to hyperventilation. So hyperventilation is an abnormal increase in the volume of air breathed in and out of the lungs. It's something we've all experienced because it can be induced by stress, panic, or anxiety. It can also be caused by hypoxia and a decreased carbon dioxide in the blood. So this is you're breathing in too much oxygen, and you're not getting enough of that carbon dioxide that your blood needs. Some symptoms of this are lightheadedness, nausea, suffocation, drowsiness, blurred vision, and a rapid pulse. Some more about hyperventilation. Some effects of it include a significant distraction to the safe operation of the aircraft. Obviously, usually induced by a panic. You're not going to be able to fly or make good judgment skills. It could even incapacitate the pilot, eventually result of lack of coordination, disorientation, and painful muscle spasms. Even unconsciousness can occur. If unconsciousness occurs or incapacitation, the body will naturally recover from the situation. As you're unconscious, it will slower the breathing rate. But some things you can do to avoid that is by talking out loud, control breathing in and out of a paper bag that's held over the nose. One thing to note about the paper bag is by putting it over your nose and your mouth, you're kind of able to trap that carbon dioxide in the bag, breathing more of it in as you're breathing out, kind of capture it so that obviously hyperventilation is the decrease of carbon dioxide, so the paper bag trick is one way, and also you can kind of see your own breathing. You can see the slow, controlled breaths as the paper bag inflates and deflates, so it serves more than one purpose. Another corrective action could be just removing the cause of stress, panic, anxiety if you're able, but that always sounds easier said than done, but it's something to think about if this ever happens. If the source is an emergency that must be dealt with immediately, take a moment and remember your emergency procedure training. That means descending to a low altitude if you need to, remembering the symptoms, then the effects of hyperventilation, and the corrective actions, and take precautions as you need to. So middle ear and sinus problems. So we have things called ear blocks and sinus blocks. And prevention is pretty much the same for both. So an ear block is your eustachian tubes inside of your ear are allowing the equilibrium as pressure changes. But these can get blocked and cause severe pain and hearing loss. For a sinus block, air pressure in the sinuses will equalize through nasal passages, but those can get blocked as well. Symptoms of that would be excruciating pain, upper teeth ache, or bloody mucus. Prevention for both of these typically are not flying when you have allergies or a cold. If you already know that there is some sort of block, flying will make it worse as the pressure changes. Using adequate protection is usually not provided by a decongestant sprays or drops to reduce congestion around the sinus openings. So these sprays that would kind of clear you up if you are on the ground might not have very good protection for you when you actually get to a different pressure when you're in this air. So they usually do not work well, so that's why it's just best not to fly at all when you have allergies or cold. The sprays won't have much of an effect. Same with oral decongestants. They can also have a side effect that can impair pilot performance, which goes back to calling your AME or visiting the FAA website of what medications you can and cannot fly with. And if you ever have any questions, always just call the AME. If you don't see it on the website or can't do it on your own, it's always best to ask. So, spatial disorientation. This is the lack of orientation with regard to position, altitude, or movement of the airplane in space. So, the body uses vestibular, somatosensory, and visual systems to determine your orientation and movement. So, when spatial disorientation occurs, it's because it's a result of when all of these three systems are have information conflicts. So our vestibular would be found in the inner ear, which is the sense of position because of balance. And then somatosensory would be the nerves in your skin, the muscles and joints. It's the feeling, or as we call it, the seat of the pants. And then there's the visual system. This is your eyes, which sense position based on what it is seen. And when one of these get conflicted with one another, it's going to cause spatial disorientation. Motion sickness. So motion sickness is very similar. It's the brain receiving those conflicting messages about the state of body, but it's going to cause discomfort and nausea, dizziness, paleness, sweating, and vomiting. The effects of this will be distraction or inability to control the aircraft for safe operation. You're going to be focused on your discomfort or your nausea. You're not going to be paying as much attention to how you're operating the aircraft. Some corrective actions could be opening fresh air vents, focusing on objects outside the airplane, and avoiding unnecessary head movements, because of course those head movements go back to your spatial disorientation. Somatosensory, it's what you're feeling, and could just make things worse. So not only would this be an issue for the pilot themselves, but also it's great to know for when you have passengers in the plane. Passengers typically are not flying as much as pilots are, so they're more prone to getting motion sickness, having nausea or dizziness. So it's good to know what corrective actions to take to avoid this from getting worse with your passengers. Now I'll talk about carbon monoxide poisoning. So carbon monoxide is a byproduct of the incomplete combustion of carbon-containing materials such as aviation fuel. So some cause of this would be the fumes that escape through cabin heaters, because our cabin heaters are utilizing that airflow over the exhaust manifold to heat the cabins. If there is a leak or a crack, sometimes that carbon monoxide will flow through into our cabin. So some symptoms of this will be pressure in the head, drowsiness, dizziness, maybe ringing ears, confusion, even vomiting, convulsions, cherry red lips, or incapacitation. So effects of carbon monoxide poisoning, it could take up to 24 hours to even recover from this. Some corrective actions you could take is to shut off the cabin heaters, because that is a viable cause for the carbon monoxide poisoning, and opening the outside air vents, getting fresh air in. One thing to note as well is our planes at Middle Georgia have these carbon monoxide detectors. You just peel them off, stick them in the plane. The dark spot will indicate danger, as it says, so it will change colors if it does detect carbon monoxide. And then it does have an expiration. It will tell you the date opened, and just get them changed regularly. And they require no batteries or anything, so very useful. Fatigue. There's two types of fatigue that we talk about, which is acute fatigue and chronic fatigue. Acute fatigue is a normal occurrence of everyday living, so this is just the tiredness felt after a long day, either physically, you went to the gym for too long, or it's a mental strain. You were in class all day, you've done tests, you had a long day at work kind of thing. So it's pretty normal, and it lasts less than a month. And then chronic fatigue, on the other hand, occurs when there's not enough time for full recovery between the acute fatigue episodes. So you have a long day at work, Sunday through Friday, and the same thing the next week, and the same thing after that. There's no break in between. You'll become chronically fatigued. So causes of fatigue can be many things. It could be a lack of sleep. It could be excessive physical exhaustion. It could be grief or emotional stress. It could be boredom, and it could be even a lack of activity. All can cause fatigue. Some symptoms of this would be tiredness or sleepiness, a headache, dizziness, sore aching muscles, or feeling weak or irritable. Some more effects of what fatigue has on us as pilots would be inaccuracy, forgetfulness, missing your radio calls, slow reactions, poor judgment, and a loss of situational awareness. You're just not thinking straight. So in order to prevent this, and corrective actions against fatigue would be, of course, since there's many causes of fatigue, there's a lot of prevention and corrective actions that you could take. So if the fatigue is caused by lack of activity, you can try exercising, you can eat. If it's caused by a lack of sleep, try sleeping. It could even result to going to therapy to find out the cause of your fatigue and how to prevent it. Caffeine and alcohol, of course, just things of that nature. So, stress is the body's response to physical and psychological demands placed upon it. Some causes of stress is any activity, event, or other stimulus that can cause stress is referred to as a stressor. So these can be internal, which is cognitive or physical, or external, which is the environment to the individual. So this could be an emotion that's causing you stress, or it could be an upcoming test, or just the environment that you're in causing you stress. Some symptoms, of course, we've all experienced stress. We know it's increased heart rate, high blood pressure, shortness of breath, could be hyperventilation, nausea, headaches, sleep disturbances, and just general weakness. Some effects of stress is anger and guilt, mood swings, low self-esteem, depression, a loss of interest or loss of control. Some corrective actions for stress could be first, recognizing a stressful situation or a condition, preparing that it's going to be stressful, what you can do. You can anticipate it, you can plan for it, try to reduce the amount of stress. You might not be able to completely eliminate it, but by being prepared, you can reduce it. Learning how to deal or cope with stressful situations. This may involve therapy if you don't have coping skills for stress. And this is a very regular occurrence, especially with pilots and taking check rides. It's all very stressful, and if you cannot cope, it's going to lead to probably some catastrophic situations. So learning how to deal and cope and plan and anticipate and prepare for stress is very important. So dehydration, so it's kind of an overlooked topic, but it is very important. Some causes of this would be a hot climate, humidity, caffeinated drinks, and of course alcohol makes you dehydrated. Symptoms is obviously feeling thirsty, but also fatigue, dry mouth, tiredness, and dark urine. Some effects would be poor decision making and poor mental and physical performance. And some corrective action is, of course, drinking plenty of fluids and eating fruits and vegetables, anything that's high in water. Circling back to alcohol and how it affects the safety of flight. So alcohol would decrease the ability of the brain to make use of its oxygen, as we've talked about. Some studies have shown a decreased pilot's performance with blood alcohol concentrations as low as 0.025%. And as we know, the limit for us is 0.04%. So you can see even just a little bit could significantly decrease performance. So it would be impaired reaction time, reasoning, judgment, and then memory, imbalance, double vision, difficulty focusing, are all symptoms of alcohol and how it can affect the safety of flight. Other effects of alcohol are mitigated under certain conditions, such as fatigue, medication use. Magnified under certain conditions. So mixing alcohol with medication can magnify the effects that I just read. Altitude, flying at night, or in bad weather can all magnify the effects of alcohol. Even hangovers, even though you're still not intoxicated, it can be just as dangerous as the intoxication itself. Your judgment is impaired, you have headaches, you're not thinking clearly, and it can be just as detrimental. I believe lastly is scuba diving. Scuba diving is important to remember because of the decompression sickness that can occur. This is when nitrogen bubbles are being dissolved in the blood and tissues by high pressure and forms bubbles as pressure decreases. So the rule with scuba diving and aviation is 8,000 feet. If you're flying above 8,000 feet MSL and below, wait at least 12 hours after scuba diving, which is not required a controlled descent. And then wait at least 24 hours after scuba diving that has required a controlled descent if you're going to be flying 8,000 or below. Above 8,000, you have to wait at least 24 hours after any scuba dive, doesn't matter what it was.